Welcome, everyone. This is Heather Riggs with the New England Museum Association. I'm Director of Administration here at NEMA. I just want to have you guys all join on us. We have about 200 people registered for today's webinar, so there's a lot of little heads right now popping up. So to keep us going and stuff like that, if you guys want to type in the chat feature where what museum you're coming from, that would be great so you guys can see everybody on the call and everything like that. And so this is going to be an ongoing discussion, so you will have the opportunity to actually speak. So you can either raise your hand virtually. There is a little button on your screen that you can do the hand raising. We could call on you, or if there's an opportunity, you can speak that way. Today's session will be recorded and available on the NEMA website later this afternoon if you need to come back to it or share it with your colleagues that were not able to make it today. So I'm actually going to be turning this over to Meg to get the ball rolling with all of our facilitators and speakers today.
Great. Thanks so much, Heather, and thank you for being here. We particularly want to thank our panelists, Eric from Newport Restoration and Arnani and Amanda from the East Boston Neighborhood Center, and also Karen from Springfield Museums, who I haven't seen yet. So Karen, if you're on, if you'd raise your hand so we can find you and unmute you so you can join the panel, that would be great. So this is a really important conversation. It is only the first of what will probably be a number of conversations around this topic. I know some of you were on our conversation last week that specifically had to do with exhibit-related questions around reopening, and I expect we will probably be doing a lot of follow-up conversations. So if you have any kind of questions or thoughts that don't get addressed today, please feel free to email me and Heather, and we will happily set up some further discussion. But to start off, Eric, would you give us a little intro to the kinds of things we're going to be covering today, and then we'll hand it over to Ernani and Amanda to give us our public health overview.
Right, so sure. So as I think I said to Heather and Meg the other day, this meeting is in some sense a reflection of my terrible impatience as a human being. Like so many of us, in the museums, when the pandemic hit, we moved to create as much online content as we could to be as relevant as we could in the online space. And then my team and I immediately started thinking about what a reopening would look like. And we attended webinar after webinar, and we just didn't see any that were getting at this question. People were thinking about the past, how the last SARS epidemic, how to respond to that, or how to respond to natural disasters. And the truth is that what we're experiencing right now is unprecedented. And the discussions that we've been having internally feel very alienating because we're not having them with the field. But it was, of course, my impatience, because last week, Museum did a session on reopening. The session that NEMA did, that Meg refers to, which was ostensibly about hands-on exhibit design, became a town hall session on how do we reopen and what are the things that we need to do to reopen. And ultimately what we wanted to do here was have a forum to discuss our reopening plans, to think about them in a public way so that we don't feel so alone. And one of the things that I asked, which Meg miraculously pulled off, was, wouldn't it be great if we had some public health professionals with us in this discussion? And so I'm actually going to turn it over to them, because Amanda and Ernani, and I'm going to get the name of your organization wrong, so maybe one of you can tell us the name of your organization and perhaps talk a little bit about the discussion we had yesterday as we prepare for this.
Sure. Should we jump in? All right. Well, thank you, everyone. Thanks for inviting us. Amanda and I are really excited over the next half hour to an hour to join you. First, we also want to say, so we're from the healthcare sector and legal sector. We work at the East Boston Neighborhood Health Center. We are one of the largest community health centers in the United States. What makes us unique is that we are patient run. Our board is actually majority patients, so very unique among among healthcare institutions. And we serve over 90,000 patients in the greater Boston area. We've been dealing with this epidemic in a very direct way now since at least February. We do have good news. I think what we're seeing, at least in New England, definitely in Massachusetts, of cases dropping down, symptoms coming down. So the social distancing, very blunt instrument, but it definitely has worked, and we're ramping up testing and so forth. So good news on that front. I just want to note, I am myself, my family, we love going to museums and we enjoy it. And I think for all of us, I say this not just me working in healthcare, but personally as well, a lot of fear of loss, I think, in the past few months of life, of what makes us people and human. And what you folks do out there is cultivate and preserve that culture and that common humanity, the reasons why we're people and why we want to be people. And so thank you. So to the extent that we can help a little bit this morning, we're happy to do so. So I'll introduce as well let me introduce my colleague here, Amanda McGee, who is our Assistant General Counsel. We stole her from a big national law firm, and she's now doing wonderful work for us. We can't pay her as much as that big law firm, but she loves helping the community and being part of the nonprofit world, as many of you are. So we're happy to have her, and she's our expert on employment issues and OSHA issues, and we'll have some issues that she'll address in a moment. So just to get started, and I know, I don't know how the format will be if folks want to jump in with questions, but I have a few issues I do want to, generally cover, and then we'll be open for specific questions.
Well, Nani, we'd like to sort of briefly share some of the plans that we've been thinking about and get some feedback on that, and then sort of move into questions from there.
Oh, sure.
Okay.
Perfect. Very good. Okay. So in terms of where we start, and this is unprecedented and kind of new for us to be advising other industries on general health issues, especially public health issues. So where we do start with folks is what I think most folks know is to be in touch with the guidelines, the analyses, the understanding coming from the CDC, and then coming from your state departments of public health, and then your local town, if you do have them, public health as well. That's kind of your baseline of understanding what you need to do with respect to social distancing, what you need to do with respect to testing, thermometer checks, for fever checks for patrons or employees. So I would always start with that as your baseline, and then if you guys were, my client, our client is our organization, that's where we start. And then we recommend that folks, you have to wrestle with a lot of the guidance coming up, because it is changing. I think you've seen the issues that we highlight for people that have been challenging and a little frustrating is two in particular. One, around masking. So I think if you remember at the end of February and March, the CDC guideline was, well, you don't really need masking, and then they kind of ramped it up over time. And for us, our understanding was that it was really a rationalization of being in the United States and not having access to masks. If everyone did have access to masks, it probably would have been a universal requirement right away. So you're probably going to see a lot of that where the public health experts are doing the best they can with the information that they have. But at the same time, you need to do, if you need to go beyond that, I do recommend you go beyond that. The other issue we've seen is around physical plant issues as well. And the example we give is around air quality inside facilities. And initial studies showed that the disease itself probably wasn't being aerosolized, that it was, it's basically droplets, and our mission at the health center was prevent the spread of the droplets. But there are instances that we're learning now where it is aerosolized, especially in enclosed spaces, bathrooms in particular. So at our facility, we're going above and beyond in HEPA filters, air quality improvements, It can be expensive. You do have to maybe some, depending on your buildings, retrofitting and so forth. But we're adding that extra layer of protection, even though it is actually not required by the CDC or our Department of Public Health. So wrestle with those sources, but have that be your starting point. And I'm going to jump in a moment right now into the broader liability questions. But just as if I'm not giving you directly legal advice because I'm not your attorneys, but the advice I do give to folks is that has to be your starting point, so that if someone does challenge and say, well, why didn't you do X, Y, and Z? You have to be able to say, well, here's the national guidelines. Here are the state and local guidelines. We followed them. And that is basically your main protection against claims either from employees or patrons. Now, on liability, that's also an evolving issue, and I would recommend you focus on a few things. One is keep track of the movement at the federal level and then at your state levels with respect to liability for employers around COVID-19. And at the federal level, there's a move on the Republican side to kind of have a very broad grant of immunity to employers, so that basically if your staff gets sick while at work, or if your patrons or customers get sick while you're open and providing services, that your entity would be immune from lawsuit if it is COVID related. There's a tension there where on the one hand, that is a very nice, clean way to protect a business. The other side of the tension is that you as running the business are in the best position to protect your employees, to protect your patrons and your customers. So there's a potential there to create a moral hazard issue where if you are given this broad grant of immunity, that then you might not put in the resources, you might not protect your employees, you might not protect your patrons. So I don't know where this is going to land, but I would recommend you monitor that very closely. I recommend you stay in touch with your insurers as well. So your property insurance, any of your insurance or unemployment claims, and then your general liability insurance. I think it's going to be critical to understand what your policies are. One issue that we've seen come up is many of these general liability policies can have a specific exclusion around infectious disease. And so basically it just shows that insurers think of everything, so you might have this, you're like, well, I have this great general liability policy, we pay every year. And then in the fine print, it says, if any of your losses or if any damages are because of a pandemic, you're not going to be able to collect from your insurer. So please, I'd recommend you go check that. There's a lot of legalese, so I do, talk to your broker and so forth. So check that. We'll be happy. We're learning that as we go as well. So we're happy to address issues that folks have on that. And then finally on the liability front, Amanda's going to go into more detail around employees and so forth. But I just do recommend that you do get in touch. I know some of your organizations are large. You may have an in-house counsel. You may have regular access to outside counsel. Small organizations, might not have that same access. You might have to pool resources, but it is going to be very important for you to understand what your state law is, and just to make sure that you're abiding by that. And maybe this is probably a good segue before we go into kind of best practices in a moment, but segue to Amanda and talk a bit about the employee and other related issues.
Sure. Thanks so much, Ernani. As Ernani mentioned, I've been really in the trenches managing employee issues surrounding COVID. So as a healthcare provider, we've been certainly focused on provision of tests and treatment for our patients, but also we are an employer who has had employees both telecommuting and also employees who could not telecommute who are present at our facilities, working at our facilities through the pandemic. So we've had a lot of lessons learned from that experience. And what I'm drawing from those lessons is really the importance of implementing written policies and procedures surrounding everything you can think of pertaining to employee management for their protection from COVID. By that, I mean telecommuting policies, who could telecommute versus not. And for those employees who will be physically present at your locations once you reopen, how will you protect them, and how will you ensure that you're following the same process for each of them? And that's how you do that via policies and procedures that align with your state law. As you think about reopening, my suggestion would be to think about it in terms of the safety of your patrons who are coming, the general public, and also separately the safety of your employees. For the second bucket, I would consider thinking about a few things. How would you implement social distancing for your employees who are physically present at the facility? That might range from anything from separating out their desks to making sure they're able to socially distance in break rooms, to ensuring that there's a physical barrier between like a frontline employee who might be taking tickets or having direct interface with general public. Is there like a plastic barrier between the employee and the people coming inside the building? Do you have written those written pads that people sign their names on if they are paying by a credit card? Is there a way to keep that clean? And then also with respect to employees, what do you do if an employee presents with symptoms? Do you have something written down that you can follow so that you ensure that you're following the same process for each of them?
If I could jump in here for a second, I want to acknowledge that Linda and Cam and the folks from Mass Air and Space would definitely see the question about paid employees versus volunteers, and we'll definitely try and address that. I mean, maybe we actually start there, right? So yesterday, Ernani was talking about HEPA filters, and I said, geez, some of the museums in Nima are 200, 300-year-old houses that don't even have air filtration systems. And so, sort of thinking about the ideal practices versus the reality of what museums cope with. And so maybe we could bring this question to you. When I left LA, every job on the museum floor, except for very few at the museum I used to work at, was a volunteer position. In Newport, it's a little different. In Newport, there are a lot of positions that are typically volunteer that are paid, but throughout the museum community, museums rely extensively on volunteers as docents, even in selling tickets, sometimes in sort of behind the scenes capacities. So I guess for the two of you, is there or do we distinguish between those two things, or are volunteers and paid employees treated identically?
Amanda, do you want to?
Sure. In terms of, so first of all, your state law may have some color that you'll need to look at for this. Generally, in terms of treatment of the folks who are on your premises, whether via employees or volunteers, I'd suggest embracing a similar protocol and processes for their protection and safety in a uniform fashion.
Mm-hmm. And one of the things I think the group can acknowledge, those who have worked with volunteers, is one of the big differences, of course, is that a volunteer can leave. Mm-hmm. Of course, an employee can, but they have so much more at risk that they probably don't. But volunteers literally can say that I'm done. And as somebody pointed out here below, and maybe here's a moment where I'll talk about sort of our plans. Many volunteers, and I would argue not just volunteers, but what we see in the paid staff down in Newport, are in one of the most vulnerable populations. They're frequently seniors, certainly over the age of 60. And this is something that this is one of the things that sort of, it doesn't keep me awake at night. That would be hyperbolic. But it's the thing that bugs me the most very often as I think this through, which is that I depend on a frontline staff who is extremely vulnerable. And our plans with regard to this are at present, we are looking to remove any ticket contact. All ticketing, in all likelihood, will be online when we reopen. That will sort of reduce sort of engagement. We are hoping to move any kind of orientation space outside, where we feel, first of all, we just have seen anecdotally that visitors are more comfortable with being outside, and it creates an opportunity for more distance, at least at our place. We're going to, unless the governor says no, we're going to require all of our staff and all visitors to wear masks. And Ernani pointed out yesterday that there may be ADA questions about that. But this is one of the things that just bugs the heck out of me, since we saw what went on in Michigan and in Oklahoma, is what do I do with the person who shows up and says, I'm not wearing a mask, this is all a hoax, and blah, 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 blah. How do I cope with that? Because I'm really not interested in welcoming them at that point, because they put my staff at risk. And, what do we do in those circumstances? The person who claims, that they're not going to wear a mask threatens our staff in significant ways. Do we have the right to just turn them out, even if they are citing an ADA issue?
Yeah, so happy to address that, and then the previous issues as well. So maybe I'll start in reverse order. With respect to the masking requirements, safety, and so forth, you are private institutions, I think for the most part, across all your members, right? So you basically can dictate what occurs on your property or what doesn't occur. You do have to check your state law, but for the most part, you can exclude individuals as long as it's not for a discriminatory purpose. So, for example, if someone comes in, let's say masking and a public health issue aside, although that actually gives you way more authority to make these changes. But if someone comes in is loud, obnoxious, is drunk, those things, like that, and alert public safety or police or whatever. During the pandemic, especially if your state does have a masking requirement, so Massachusetts has I think it's a general requirement across the state, but it's only enforced only if the locality wants to enforce it. Many folks seem to be abiding by it, but you can definitely require it at your institution. So you can exclude any patron that comes in and says, I do not want to wear a mask. The one case that I would be looking out for is the potential ADA cases. So if someone says, I visibly have oxygen in my nose and I really can't wear a mask, or I have to wear it in a way that I have to remove it at times. You just have to be mindful that those individuals may be able to say, despite my best efforts, because of my condition, I cannot wear a mask. And then I think you should just deal with those cases on an individual basis, but with the understanding that the rule is everyone needs to be masked when they're coming in here. A few things that we've seen institutions do in terms of best practices. Lots of folks right now are bringing in their homemade masks. If you have the resources, you may be able to actually have a standard, surgical mask. If you can access those masks, they are becoming more accessible now as supply is increasing. And say, okay, once you come into the facility, you can wash your hands here, and then you can put on a mask. So everyone has a standard mask that could give both patrons and your staff more comfort. I would so those are patrons. With respect to your employees, you can definitely require them to wear masks, and then just the same as you be mindful of the ADA related issues. But you can terminate an employee. Massachusetts is an at-will state. You got to figure out what your how your state law works around employment. But it's definitely if they're not following that policy, and as I think Amanda raises the great point, which is have these issues addressed up front, so that if anyone does question, well, why was I treated this way? You can point to that policy and say, actually, we've thought this through. We're treating everyone the same way. And your policies can change. Just let folks know. Maybe this month and next month, masking is required. And maybe as things, maybe a therapeutic comes out, at the end of the the end of the summer, or a vaccine, or a better understanding of how the disease is transmitted, and maybe the rules change. But just make sure that you've memorialized. Doesn't have to be anything kind of major, but just memorialize what your policies are in case it's challenged. With respect to your practices around contact, I think you're on the right track. I would really work to reimagine how you interact, how your staff and patrons interact with each other, that that minimizes physical contact. Amanda raised the issue of those signature pads. For the health center, we have a lot of procedures that by state regulation required signature. So for example, pharmacy, getting a prescription, a lot around payments to make sure that people are committed to paying, or their insurance company will pay for services. All of that has been waived as of March by our state. And then there's been federal waivers as well. So one thing I will recommend to folks is if you think something's common sense to not do anymore, like for example, signing credit card statements, then do the homework either with your state or with a vendor or whatever, to say, is this really necessary during the pandemic? And I bet the answer is no. It's better to risk non-compliance on those issues than, of course, to potentially spread the disease to an employee or to a patron. So to the extent that people don't need to sign, don't need to take the physical tickets, I would highly recommend that. What we've seen in other businesses, and we mentioned this in the pre-call, is around hours. We do see businesses are getting flexibility from their towns, from their cities, to extend their hours, so that they can have their employees and their patrons come at staggered hours. That, I don't know if that may or may not be meaningful for your organizations, to have folks come in the evening or come later at night. We've been advising folks in the construction industry, and it is very meaningful. Usually it's hard and fast. You start work at 6, you have to stop at 6, but those hours are becoming flexible, so that, especially for interior work, so that you don't have too many people crowding at the same time. You don't have like the plaster guy and the plumber in the same small space. So definitely look to your local governments for flexibility. And maybe I'll take my lawyer hat off right now, but so this is not good legal advice, but really focus on the core issues of keeping your staff and your patrons healthy, and start there. And we've seen cases, especially on the healthcare side, is moving so rapidly, where we've just done things that we knew would prevent the spread, and then the regulator, like a week later, the Centers for Medicare and Medicaid would say, "Oh yeah, by the way, we've waived that rule after you guys emailed us about it." So at the time, we were definitely in non-compliance, but who was going to get us if we were doing something that was trying to stop the spread, even though it was non-compliant with what regulations are existing that day. That is very bad legal advice. But I think that your frame of mind should be, how do I keep folks safe? Both to protect yourselves, your patrons, and then also your reputational risk as well. Because if your organization, if folks find out on social media or in the media, hey, 2 employees got sick at X museum, that's going to set you back. If those folks get very sick, obviously it's terrible for them and for their families. But then there's just the perception issue as well, that it's going to hurt you business-wise to build that confidence again for people to come work for you and kind of come help come to your services going forward. So,
Nani and Amanda, we have a couple of other questions. I know we were, Eric and Karen, we're going to talk a little bit about some of the plans that they're doing. Some people wanted to know about temperature screening for staff and visitors. Is it worth it? Are there HIPAA concerns? Is it just sort of theatered given how many people are asymptomatic? And then people also want to know if you've got a higher legal responsibility to provide a safe work environment to your staff than to your volunteers.
Okay. So with respect to temperature checks, we do recommend that if you can do that, that you do it. We are, one, we're doing it at our health center, but also, and we're a different business because for sure that people are coming to us for COVID because that's where they're supposed to go. We're recommending it to the industries that we're working with if you can get your hands on. Right now, I think supplies are increasing, but there is a shortage of those disposable thermometers. Some folks are using, to good effect, the handheld guns. You can definitely do screenings, and I recommend you do that. Definitely have a policy. Look at the CDC site for what the visible symptoms are. So, patrons or staff come in with a dry cough. If they have a fever, then you can definitely exclude them. Just make sure you have a policy around that. As Meg noted, from the question, it's looking like the number of individuals that are asymptomatic is much, much higher than people expected and understood in March and April, which is good news, because maybe many folks aren't getting hit as hard, but it's bad news because you could have it right now and you could be spreading it. I think our current understanding is that if you're not symptomatic, you're not shedding the virus in the same way as if you are symptomatic. So basically, if you are symptomatic, there's more likelihood that you're projecting this virus and shedding it, and it's multiplying, and you can infect more people. But you can definitely get it from someone who's asymptomatic, especially the touching pieces. So that person touches that asymptomatic person touches their mouth, their nose, touches a railing, touches a computer keyboard, and then you go and touch that. You touch your nose, you touch your face. You can definitely transmit it. Probably a lower risk, but you can definitely get it. So yes, you can do those screenings, and you can exclude folks that have a fever or that have a cough or any visible symptoms of illness. But just be mindful of how to express that and track that. And you can definitely initially err on the side of exclusion. I would just do it in a way that you're not alienating either your staff or your customers. I'm sure you know that. And then the other question on how to treat staff versus volunteers. So I think Amanda highlighted the issue of you're providing protective equipment, you're providing protocols and so forth for everyone that works for you. In terms of if you endanger, let's say for example on a liability issue, let's say you don't have any protective equipment and you're crowding people together. And a volunteer suffers injury because of that. They could still file a claim, and you got to check what your state law is. So you're still liable if someone is working for you. It may be different. There may be different protections in terms of wages and what you owe them and damages and so forth. But just be mindful that from the COVID kind of related protections, you should treat all of your staff, whether they're volunteer or paid staff, the same. You have way more flexibility with your volunteers because even if so under Massachusetts all employees are at will, but your volunteers you can from one moment to the next you can say hey, I need you to leave, you can't work for us anymore. It's a much easier kind of activity there. I don't know if that addresses that question, but I'm happy to.
Well, it's interesting. Your earlier comments about temperature taking raised quite a chat fuss, which okay. Because we've struggled with this as well. The question of who's going to be in the business of taking those temperatures, and how do I maintain 6 feet distance if I'm now asking somebody to go take someone's temperature? And it raises a bunch of questions. Another question that came up was about this concept of will people be walking around with immunity IDs, and what happens if we show them? And then the last piece is, okay, so somebody comes in with a symptom, they have a cough, but it's from hay fever. right? I mean, I don't know that we can distinguish that, right? But so there are these questions of, once you ask museum people to become not medical professionals, but at least engaged in medical questions, how are we going to do that? This feels like a very difficult lift.
Yeah. So a few things on that. So, great point. And I probably should have had the different perspective on the fever checks in particular. We've been working with the construction industry, which in Massachusetts has all kinds of resources and money on the planet. So they're hiring vendors, including our health center, to have trained medical personnel to do those checks. So I'm going to guess that your local towns and cities aren't going to require, it's not going to be a requirement to do those checks, just because of the issue you raised, of like who's going to do it, can we afford to hire a vendor to do it, and so forth. Because you're right, there is a very strict process of the distance between the individual and the person doing the check. The individual checking for symptoms is in full protective equipment. That's how we've had it set up. So mask, face shield, gown, because you don't know if that person's symptomatic or not, and we want to protect that individual. So so that great point on that. I would consult with your local city or town what they're recommending, requiring. To the extent that the larger institutions, I think it's a good thing to have potentially. I've also seen folks, not with patrons, but with respect to their staff, kind of an honor system of, I'm going to take my temperature, I'm going to check, my symptoms, and before I come into work. That works for, especially for salaried staff and for individuals that have paid sick leave. And I don't know if every state in New England has that. Obviously, if folks are worried they're not going to get a paycheck if they're excluded from work, there's a disincentive there. There's a challenge there, and I think you hit on that. It is not your industry, and how do you institute these practices? Maybe partner with your local healthcare institution if you can, and to the extent that you can do that. If you have an employee come in and say, I have a cough and it's hay fever, you can't exclude that individual. And I recommend, for the foreseeable, through the summer, that especially as you reopen, that you have a low threshold for illness, and that you do exclude. As long as that policy applies to everyone, you do exclude. And I'll give two examples. One is we were working with a local courthouse here. Someone thought they had allergies and they were sneezing up a storm. And everyone at that time, the perception was that sneezing wasn't really one of the symptoms. And it turns out that they were positive. And then, the little cluster around them was positive. And so what looked like normal allergies, really wasn't. And maybe they did have allergies and they had COVID, we don't really know. So low threshold on that if you have people who are visibly sick, and then you'll probably have an understanding of your benefits and sick time and so forth. And then that other question on immunity. So our institution, we got off a call last week with Secretary Alex Azar, the Secretary of HHS as of today. And we talked about the testing. We're now able to test for antigens, for basically, antibodies. And then we asked, should we be doing that? We obviously have one of the tests that is not one of these, go on Amazon and get a test. We have like pharmaceutical company made test that seems to be reasonably accurate. But right now there's no clinical value to those tests aside from research. So, your public health department might say, I'm going to sample 100 people, 200 people to see if I can get a sense of how this disease is spread, in addition to doing direct testing of people who have COVID present today. So it just doesn't, we don't know if it makes you immune. We don't know, we suspect that it does if you do have the antibodies, and the hope is if you have the antibodies that you're gonna have some level of immunity, but there's really been no conclusive evidence on that. That could be coming, a month from now, 2 months from now. We don't know. We hope that we'll know that soon. And then when we do know that, then having antibodies, if it does provide immunity, then maybe there'll be some value in knowing if you have it or not. Right now, it's a novelty or just a research tool. So the whole concept of immunity badges, personally, I don't think that's. I bet we're going to have a really good therapeutic and probably an initial phase of a functioning vaccine. Hopefully I'm hoping by December or January, before it even comes to people saying, I have a certificate that shows I took a test and I have antibodies, and I can be the super volunteer, and I can touch everyone, and I can, I'm fine. I'm not going to get sick. I don't think that's going to. Who knows? But I don't know if that's going to be an issue. At least not as of June or July, as most folks are probably starting to get opened up again. So.
I see a couple
I'm sorry,
questions.
Amanda, go ahead, yeah.
Oh, I'm sorry. I saw a couple questions come in with respect to unions, and I thought maybe I could just take a minute to pause and answer those questions, since I have had some experience working with unions through COVID. So with unions, if you have unionized employees, you will need to take a look at your CBA and see what terms and job responsibilities are set out in your CBA. If you will be asking of your unionized employees things like changes to the hours of their shift or any expanding their job responsibilities beyond what is already memorialized in their CBA, you will need to negotiate with the union over those terms. I think that based on my experience, there has been some flexibility with kind of how the unions are working with employers over changing their job responsibility. Obviously, there's been a lot of furloughs and layoffs nationally, so I think that they're recognizing that there needs to be some shifts in terms of who has what responsibilities and when. So I think you can expect them to work with you, but you will want to take a look at the CBAs before moving forward with changing any of the scope of job responsibility for your unionized employees.
Is Karen on the call? Did we get her?
Yep, she's in.
Yes, she's here.
Okay, well, I feel like we've, there she is. Hi, Karen.
Hey there.
And did you want to sort of share with the group sort of your thoughts about what you guys are doing in Springfield and your concerns and things like that?
Sure. Hi, everybody. I'm sorry I was late this morning. I'm from the Springfield Museums in Massachusetts, and we have been both working on getting our staff back into the offices by May 18th, and also working on plans to reopen our museums, which we won't do until it's truly safe to do so. And of course, judging from the conversation here, we all have a number of questions about what it actually means to be safe. For us right now, we're considering all the CDC guidelines, and we're listening hard to our governor to decide on the safety measures that we're going to enact. But we're also concerned about and making sure that we've got the materials that we need to make sure that we have a safe museum. And the most, overall, we want to make sure that we have a wonderful museum experience for folks when they do come to the museum. So we want them to be able to feel free to enjoy the museums. And that will mean that we have in place already enough safety factors that they hardly even notice that they happen to be wearing masks and happen to be 6 feet away from other people in the museum system. We've been doing this mostly by talking to other museums and listening to many webinars that have been out there and looking at the plans that other museums who have opened or are about to open have put together. And I sent Meg this morning a bunch of links that one of our museum directors sent to me this morning from a number of museums in Texas that are opening.
I'll be putting those in the chat.
Oh, that's wonderful. Thank you so much, Meg.
Mm-hmm.
I read them this morning when I was supposed to have been arriving at this meeting. And I really found that we were all in line on a number of the different aspects on personal protection equipment for our staff, on making sure that our HVAC systems have the proper filters in them, adding things like freestanding air filtration systems, that sort of thing. One of the most important aspects of preparing is training. We have a number of different teams put together who each have an individual focus, like cleaning or social distancing or communication. We know that it is possible that folks will come to museums and not want to put a mask on. And we want to be able to talk with them in a way that either makes them feel truly welcome to come in with a mask on, or understanding why they need to leave. We have a supply already of disposable masks that we're going to sell at cost to people who come to the museums who don't have a mask. We are mostly, first though, trying to make sure that our folks are comfortable coming back to work. We've all been through this incredible, or we're going through this incredible time period. We don't know what's happening tomorrow half the time, or what news there's going to be. We have been all apart from each other. We're not used to being with anybody other than our family. So we want to really give time for our staff to get used to being together and negotiating the social distancing and mask wearing and all of that. I'll stop there for now, if that's okay.
Sure. I wanted to point out my counterpart at the Preservation Society of Newport County, Leslie, posted a little while ago that they are sort of doing a disclaimer on their tickets when they purchase, that in essence says, if you agree to purchase this ticket, you agree to follow our rules about healthcare safety. Since we have two attorneys on the call, is there any force of law in such a disclaimer, or are we just trying to, or is that, I think it was Betsy last week who spoke, or earlier this week, who spoke about the theater of cleaning, the theater of this, the theater of that. Is that sort of legal theater?
So I'm sorry, the question on...
so in other words, if I buy a ticket to go to the Preservation Society of Newport County, it's going to say, by purchasing this ticket, you agree to our healthcare precautions, which include wearing a mask, keeping distance, staying in the museum for X amount of time. Does that have any force behind it? Do such disclaimers matter when you're in such an exchange?
Yeah, I mean, I think it depends. I would generally say no, that you, as the institution, you can't disclaim liability because you're, and this all depends on contract law and on your state, but generally, you're the sophisticated party and probably had a lawyer draft that disclaimer, and then you have some regular non-lawyer kind of customer coming in. If you imagine like your gym contracts, like you sign a contract saying basically, disclaiming all liability are going to hurt. A lot of times it's kind of nonsense, but they put it in the agreement, even though no court's going to hold it up, but they have people sign it. So if you do get hurt in your gym, make sure you hold people accountable if it's appropriate. But I think being straightforward with your customers is, your patrons is important. Letting them know in advance, the liability issues both with your staff and with the patrons. It's evolving, but I strongly suspect that while there's probably going to be a lot of litigation, and maybe Amanda, you have some thoughts on this too, coming out of all the interactions as things reopen. I think there's going to be levels of protection, and it's going to be a very high threshold for someone to prove that your institution was acting in a way that was negligent, because basically the standard is going to be there's going to be a reasonableness standard, and you're going to look across all the issues we touched on. Like, I'm not a public health expert. How can I possibly assess someone's health? If the best hospitals in the country don't have access to protective equipment, how can my nonprofit have access to face shields and N95 masks and all these different things? So there's going to have to, it's a kind of a sliding scale there. on that. So Amanda, I don't know if you have anything else to add.
Yeah, just quickly, Ernani, I think you're absolutely right in terms of the limitation on liability and disclaimers associated with that. I would add, however, that to the extent that you're thinking about this from the terms of, are you creating a binding contract with your clientele, if you are asking them to purchase a ticket and say, as a condition of purchasing this ticket, please understand that this is the following expectations that we have for your behavior, including, for example, wearing a mask at all times, consenting to your temperature taken. And if you don't adhere to these expectations, we will ask you to leave without providing you a refund. That's my understanding is at least under Massachusetts law, that would be a binding contract with those patrons.
Yeah. So somebody asked, are you thinking about marking up your floors to demonstrate 6-foot distance and stuff? We certainly are. We're absolutely thinking about that in a way that won't make our curator angry at us because the house, our museums are housed in historic houses, and therefore the house is the collection as well. So we are certainly thinking about doing that. And then the number of people have said on the chat, and I agree wholeheartedly, our frontline staff are going to be asked to do something that nobody's ever been asked to do really in the history of modern museum work, which is take a severe risk for being on the floor, and they need our support. And my goal, I thought what I learned from you guys yesterday about thinking about every contingency, turning it into policy so that you stand behind your people with a document that you can point to is just critical. It's really important. And I don't know how many of you are from Rhode Island, but the reopening Rhode Island plan from Governor Raimondo, there's a template you can download that it's not completely applicable to museums. There's going to have to be more thinking about this, but certainly for the office place, it's asking you to sort of answer all of these questions about the contingencies, about how you keep your people safe. And I agree that I think the frontline staff just deserves our support. That if there's a question about he said, she said, or this person is unhappy, I think our frontline staff has to come first in these very, very difficult times. We are a visitor-centered business, but we're asking people to take very, very big risks, and they deserve our support. I don't know. We've got a few minutes left, right, Heather and Meg? Are there people who want to sort of comment or ask questions?
Yeah, a lot of them. I also just want to point out for those in Massachusetts thinking of just going to online ticketing, you have to accept cash.
Yeah.
Remember state laws, and that's also more of an access issue too. Not everybody has access to credit cards. People still are a cash society, so kind of think about accessibility when you are thinking of just going online. I know that makes it a little bit more difficult on that one. So there's actually a lot of questions that came up in the chat that I think we're going to have multiple town halls to discuss all of these. This is more of like the legal aspect of everything, but I think a lot of questions, a lot of really good questions about the frontline staff, stanchion, spacing, and stuff like that. I think we're definitely going to have more of these conversations to talk to each other to see what everybody else is doing as well.
Can I respond to Audrey Thompson just asked a question about free admission in light of what, because our experience is going to be notably different than what it has been before, and we've toyed with, I've certainly toyed with this idea in my mind and have rejected it, not because I don't want to give away free tickets, but because free admission tends to generate large crowds. Like the last time we opened the grounds at Rough Point for free, 300 people showed up. I don't want 300 people at Rough Point at one time this year. It's just, I need to keep people safe. And part of that, I think, is going to be the cost of a ticket. And that may be, that may be wrong of me, that may seem greedy or mean, but the intention is really to protect people. I think the cost of a ticket will reduce some of the crowding. So, are there other questions that we want?
Can I make a note just quickly on the cash issue, because it actually came up for us where we have a number of undocumented patients, and they might not have access to credit. And so with respect to our co-pays, we moved to electronic for everyone. But with those individuals that don't have access to credit cards, we were able to waive those co-pays, and then we're seeking grant funding from the city of Boston and so forth to cover it. So I would recommend if you do have individuals that need to pay in cash, maybe they are of an income level that you might be able to qualify. So maybe if your local town is, or you can raise funds for that to say, can I provide free entrance to certain individuals of lower income and so forth, so you don't have to deal with cash. If you do deal with cash, then obviously gloves, protection and so forth is really critical. But that's how we did that workaround for us. But just to know that. So.
Can I just answer a question that I saw come through the chat really quickly about taking affirmative steps to exclude folks based on age or perceived high risk status? You as an employer cannot take those steps in terms of singling someone out because you think they may be in a high risk category. You really need those folks to come to you and ask for an accommodation, because you're going to be in violation of anti-discrimination laws in your state if you do that. So you need to wait, see what they come to you with, take all steps universally to protect folks, and see who comes and asks because of a particular status, whether it's autoimmune disease or they're over 65. If they ask for an accommodation, then you evaluate that on a case-by-case basis.
If I could just take for a minute to say that we have a lot of resources available to us through NEMA, certainly, through the CDC, through a bunch of other museums that are reopening, including museums in Europe. As long as we're working together and talking together, nobody getting out in front of the pack, but working in a similar vein, we can offer our museums again to folks who are willing to come in small numbers and follow the rules that we've set out to keep everybody as safe as possible. And I'm hopeful that we will be doing this as soon as it's safe to do so, because our museums are truly the most alive when they're filled with people.
I don't know if we have time, but one of my team, Jen Davis, asked a question that contact tracing is sort of going to be really critical to our success. And I think the Roger Williams Zoo yesterday posted something about that in order to come, you're going to have to make a reservation. It's going to require that you give them a bunch of information, which might be useful in a time of contact tracing. Are there any issues, Amanda or Anani, with gathering information that might then be turned over to a public health official?
I didn't realize that institutions were doing that for that purpose.
Well, I don't think they are doing that for that purpose, but if somebody went to our museum and then found out that they were sick, or conversely, somebody at our institution got sick and public health asks us, well, who's been to the museum over the past 3 days or 3 weeks or whatever it is? Are we violating any kind of trust or rule or law by saying, well, here's everybody's credit card information and home address? Is that a problem?
I would that's a very good issue to resolve up front, I think. Understand what your organization or institution's kind of ethical kind of duties are. But really, ultimately, I think I would converse with your State Department of Public Health, and they by law they can compel certain disclosures. So find out what is what you'd be collaborating on, what you'd be compelled to hand over, and that'll be, I think, state specific. I think for the most part, I see in Massachusetts, we have an extensive and growing contact tracing program. I think it's basically really the willingness of the individuals contacted to disclose information. I don't know if they're involving. I have to find that out, and I can follow up with the team here. if they're involving institutions to hand over information. I think, so part of it is government might be able to compel it in some circumstances. Part of it might be just collaborating to make sure you protect your patrons. But then the other side of it is, if someone, folks might feel like, if I go to this place, they're going to hand over my information to the government, and that could be concerning. We're seeing that a lot. Probably imagine folks that are, very kind of, freedom-loving kind of Americans and very important. But also think of this, the other side of like, with undocumented immigrants in particular, they might not want to show up if they think that their information is going to be shared with a government entity. And we've had that issue come up recently with a federal program to pay for COVID testing. And there's no guarantee that information will be shared with ICE. And so we're very reluctant to share, to give our patient information. As a health institution, there's different federal laws around how we protect information, but so you guys definitely have way less kind of responsibilities on that front. But yeah, I think it's just to be mindful of it, maybe to think and talk through that with the proper parties before you put that out to patrons. So.
All right, well, I want to be sensitive to everybody's time. I know Ernani and Amanda are extremely busy at work these days, as are we all. So thank you, everybody. We are definitely going to be doing more town halls focused on some of the issues that have come up today. Thank you all so very much. Thanks to all the participants for being here. Eric, Karen, Ernani, and Amanda, thank you all for sharing your expertise and thoughts about what museums should be keeping in mind as we're planning our reopening scenarios. And again, if you have any ideas for further town halls or programming you would like to see or help us lead, please feel free to email me and Heather. Our emails are on the NEMA website. Also, you probably are hearing from Heather on a regular basis as our communications guru. So thank you all and have a good day.
Thanks, everybody.
Bye-bye.
Thank you. Bye.
Bye.